Hey guys, this is Nourah from Cabin Simplified. I'm actually on a very long drive to an external rotation, so I thought I'll utilize this time to make a video for you guys. Today we'll talk about ethics. What is ethics? I'll give you an example of an ethical scenario and how do you generally approach these questions. Now, of course, ethics is like an ocean. There's just so much about it. Now, the one thing that you do have to understand is that there is no right or wrong answer when it comes to an ethical scenario. There are just so many ways to approach one situation. But what you do need to think about is what are your moral values? What is most important to you when you think about a situation? And you have to think of this, including the ethical principles in your mind. Now, we are all professionals. There are so many ways to answer an ethical scenario question. I'll give you a simple one. Now, say for example, you go into a gas station and you buy something, maybe milk or something like that, and then you pay them. They give you the change back. You walk out and you realize that they gave you probably like extra change, like $2 extra or something like that. So do you just walk away with that change, or do you go back and give it back to them? What do you do? Now, this is an ethical scenario too, right? So what would you do? Like, you have to start thinking about how would you handle the situation? What are your moral values like? Do you think that, well, it's just $2, so I have to go back and give it back? Or do you think, no, it's their hard-earned money, it's something that I need to go and give back, it's not mine? So for me, I would go and give it back, and that's just me. And if you're somebody who thinks, well, it's just $2, do I have to like go back all the way to give it back? That's fine too, but you have to give a justification for why you feel that way. Now that brings us to the kind of ethical scenarios that we are asked. Now, you might not be asked like a gas station scenario. You might be asked something more clinical. I'll give you an example. So let's say you're a pediatric dentist or a general dentist, and there's this mother who comes with their child, and she's just very skeptical about dentists. She goes like, I'm always being overtreated by my dentist. I'm not going to let that happen to my child. And we're like, okay, we appreciate that. And we evaluate the child, and then we find out that the child needs 2 restorations in A and B. That's the numbering system we use here for kids. It goes A, B, C, D, E. And then we say that the child needs 2 restorations. The child has decay in A and B. We show the radiograph to the mother, and then go like, there's also this other tooth, I, which is totally like fully decayed. We can't leave that in there. We need to extract it. So the mom goes, okay, I'll let you extract I. I'll let you do a filling in B, but I can't let you do anything to A. I'll be like, why? What's going on? And the mom says, because I don't see anything. Like, I look into my child's mouth and I can see something black over here in B. I can see that I is like totally decayed, so I agree with that. But I don't see anything in A. And then we go, well, we see it in the radiograph. It's not something that you can see outside. And the mom goes, no, I need to see it, and that's the only way I can let you treat my child. So what do? Do you agree with the mom and you just do what you have to do and just do like B and I like the mom's asking for? Or do you do everything and tell the mom that, no, but this is what I see, and this is how we go? Okay, so how do you handle the situation? I want you guys to like pause the video and kind of think about it. Think about at least 3 different ways in which you can handle the situation. Now, when you think about how to handle the situation, I also want you to think about what kind of principles apply. And most times, all of the principles apply. So you have to kind of decide which is more important. Is autonomy more important? Is beneficence more important? Are you trying to make a balance between 2 different principles? Think about that. I'll make you take a moment there, and then I'll tell you how I would handle it. So let's go. This is how I would handle it. I'm going to tell the mother that from my best professional judgment, and by looking at the radiograph or the evidence that we have, I know that the child needs this care. The child does need to take care of A, B, and I. I cannot do selective treatment here when I'm able to see that there's something going on. I cannot neglect that. That's professional negligence on my side. While autonomy does play a role where the mother is making decisions for the child, in this situation, what's going on is the mother is potentially neglecting care for the child by denying treatment in spite of what we saw. So it is my ethical obligation and the best interest of the child to say that if you're not doing all of these treatments, I cannot treat the child. And it's absolutely okay. It just, I feel like, motivates the mother to actually get care for the child. I would say that if the mother, for example, if they rile you on and ask, like, so what if the mother says that you're neglecting care for my child? That's not true. You're not neglecting care for the child. You're in fact looking out for them. The mother is neglecting care for the child. So explain that to them and say that beneficence is to do good for the patient. If you're doing B and I and you're neglecting A, which could potentially affect the permanent teeth as well, you're doing more harm than good. So while autonomy is something that you need to respect, it's not always the case when you're seeing something and you're not able to treat it. So that is how I would handle it. But there are so many other ways to handle the situation. You could be someone who says, well, I don't want to leave the child and not do anything for the child. You might be like, okay, I'll do B and I, and I'll if you're okay, we'll send you to another pediatric dentist who could probably take a look at it, and you could take a second opinion or something like that, and then decide what you want to do. In this case, you could give principles like non-maleficence. You can say that if I deny care, if I say that since the mother is demanding so much, I'm going to deny care, I'm probably doing more harm. What if the mother is not going to be able to find care at all after that? What if I just neglect B and I as well, instead of just leaving one tooth? I'm just going to treat those two teeth, and I'm going to refer the mother to a pediatric dentist to get a second opinion about A, so that we do a little bit of justice for the child. And we are also upholding veracity in our profession by being honest about what we see, and we are the professional here. While patients do have a say in their treatment, it doesn't mean that you compromise the quality of care that you provide to them. So if you kind of noticed how I approached this, I was thinking out loud about the ways in which I can handle the situation. I promise I did not shoot this in like two different ways where I thought about it and came back to you. I was actually thinking about how to answer this on the go. But what I did do is I quoted specific principles. I know that several principles apply here, but I thought that autonomy is very important, beneficence and non-maleficence. I also spoke about veracity a little bit, but I gave a little bit of justification for why I feel that way. And what that allows the interviewers to glean out of you is understand how you approach that principle and how that defines you as a person. What kind of moral values are important to you? So remember that there's no right or wrong answer. There's like 7 or 8 different ways in which you can handle the situation, and I only spoke about 2 different ways. So think about it, come up with ways in which you would handle that, and if you want me to listen to you, you can always put it in the comment section, or send a voice recording to one of our emails.